Hey everyone, and welcome back to the channel. I'm Dr. Nerita, and today we're tackling a topic that affects millions of men, but is often discussed in hushed tones: urinary leakage. That annoying, unpredictable dribble that can really mess with your confidence and quality of life. Many men assume it's just a normal part of getting older, but what if I told you that something in your kitchen, something you might be eating every single day, could be making it worse? That's right. Today, we're going to talk about diet and how it directly impacts your prostate health. Specifically, we'll uncover the common culprits that can irritate your prostate and bladder, leading to those frustrating symptoms like urgency, frequency, and leakage. Stick with me, because by the end of this video, you'll have a clear action plan to help you regain control, and it starts with your next meal. So let's get straight to it. The number one group of foods you need to be mindful of? Spicy foods. I know. For many of you, hot sauce, chili peppers, and spicy curries are life. They add that kick, that excitement to your meals. But here's the problem. The very compounds that give these foods their heat, like capsaicin in chili peppers, can be major irritants to your urinary tract. Think of it like this. When you eat something spicy, you feel the heat in your mouth. As your body processes it, those irritating compounds are filtered through your kidneys and concentrated in your urine. This concentrated, spicy urine then sits in your bladder, and if you have an already sensitive or enlarged prostate, it can provoke irritation. This irritation sends signals to your brain saying, "Empty now, it's an emergency," even when your bladder isn't completely full. This leads to that sudden overwhelming urge to go and can contribute to leakage if you can't make it to the bathroom in time. It's not an allergic reaction. It's a direct chemical irritation. So, if you're struggling with urinary symptoms, try taking a break from the heat and see how you feel. Next on our list is a big one, and it might be your morning ritual: caffeine. This includes coffee, tea, many soft drinks, and even some energy drinks. Caffeine is a double whammy for your bladder. First, it's a diuretic. In simple terms, it makes your kidneys produce more urine and faster. So you're filling your bladder up more quickly, which naturally means you'll have to go more often. But that's not all. Caffeine is also a direct bladder stimulant. It can make the muscle of the bladder, called the detrusor muscle, more twitchy and overactive. So, not only are you producing more urine, but your bladder is also more eager to expel it. For a man with an enlarged prostate, which is already putting pressure on the urethra and making urination less efficient, this is a recipe for disaster. The combination of increased volume and an overactive bladder muscle significantly increases the risk of urgency and leakage. You might not have to give it up completely, but cutting back, maybe switching to decaf, or limiting yourself to 1 cup in the morning can make a world of difference. Alright, let us talk about another beverage that is often seen as healthy but can be a hidden troublemaker: acidic juices. I'm talking about orange juice, grapefruit juice, tomato juice, and cranberry juice. Yes, even cranberry juice, which is often praised for UTI prevention. While it may have benefits for some, for men with prostate irritation or a condition called interstitial cystitis, the high acid content is the enemy. Just like with spicy foods, the acid from these beverages gets concentrated in your urine. This acidic urine then irritates the sensitive lining of your bladder and prostate. Imagine pouring lemon juice on a small cut, it stings, right? It's a similar principle. This irritation can mimic the symptoms of a urinary tract infection, causing pain, burning, frequency, and that gotta go now urgency that can lead to accidents. If you love fruit, it's much better to eat the whole fruit. The fiber in whole fruits helps buffer the acid and slows its absorption. So, swap that morning glass of OJ for an actual orange and see if your bladder thanks you for it. Now, let's move on to something that might surprise you: artificial sweeteners. These are found everywhere, from diet sodas to sugar-free yogurts, gums, and snacks. Products containing aspartame, saccharin, and sucralose are marketed as a healthy alternative to sugar, but for your bladder, they can be anything but. Studies and a large body of anecdotal evidence from patients have shown that these chemical sweeteners can be significant bladder irritants. They can increase bladder overactivity, leading to, you guessed it, frequency, urgency, and leakage. The exact mechanism isn't perfectly understood, but it's believed they irritate the nerves in the bladder wall. Many of my patients who are trying to be healthy by choosing diet drinks are inadvertently making their urinary problems worse. My advice? Stick to water. If you need some flavor, try infusing it with non-acidic fruits like melon or cucumber. Reading labels is key. If you see ingredients ending in O's like sucralose or ame like aspartame, be cautious. Finally, we need to have a serious talk about alcohol. Beer, wine, spirits, it doesn't matter the type. Alcohol is a trifecta of bladder trouble. Like caffeine, it's a diuretic, so it increases urine production. It's also a bladder irritant, causing that overactivity and urgency. But it has a third sneaky effect. It suppresses your central nervous system. What does this mean for your bladder? It means the signals between your bladder and your brain can get a little fuzzy. You might not recognize the signal that your bladder is full until it's very full. Combine that with the increased urine production and the bladder irritation, and you have a perfect storm for nighttime awakenings and leakage, especially if you have a few drinks in the evening. Cutting back on alcohol, particularly in the hours before bed, is one of the most effective lifestyle changes you can make to improve your symptoms. So to recap, the 5 big culprits are spicy foods, caffeine, acidic fruits and juices, artificial sweeteners, and alcohol. It can feel overwhelming to think about cutting all of this out, so here's my advice. Don't try to eliminate everything at once. Try an elimination diet. Pick one category, say caffeine, and remove it completely for 2 weeks. Keep a simple diary of your symptoms. Do you have fewer leaks? Are you waking up less at night? Is the urgency gone? If you see a significant improvement, you've found a trigger. Then you can slowly reintroduce a small amount and see how much you can tolerate. This isn't about deprivation. It's about empowerment. It's about understanding your own body and making informed choices that put you back in the driver's seat of your health. Managing prostate symptoms and urinary leakage is a journey, and diet is a powerful tool you have at your disposal every single day. Start by making small, consistent changes. Your prostate and your bladder will thank you. Thank you so much for watching. I hope this information was helpful and empowering. If it was, please give this video a thumbs up, and don't forget to subscribe and hit that notification bell so you don't miss our future videos on men's health. If you have any questions, drop them in the comments below. Stay healthy, stay informed, and we'll see you in the next video.